Hello and welcome to this afternoon's webinar, which is part 2 of Flippin Arthritis. My name is Felicity Thou and I'm a physiotherapist and campaign manager for the Flippin Pain team. Flippin Pain is a public health campaign sharing the latest information about persistent pain and related conditions, arthritis, with people affected by it and the healthcare professionals who look after those who are affected by it. Today's event is the second in a short series of webinars collectively titled Flippin Arthritis, which we suspect might change or flip some of your understanding about arthritis, what it is and how to manage it. These events have been funded by Haywood, Middleton and Rochdale Integrated Care Partnership for people affected by arthritis across Greater Manchester. We're aware many of you have joined from further afield and do know that you're all welcome. Today's event is being recorded and will be emailed to you afterwards, and you'll also be able to share it with others on our YouTube channel in the next 24 to 48 hours. Bit of housekeeping first, so you don't need to worry about your mic or your camera throughout this presentation, but do familiarise yourself with that question and answer box. If you click on that button, you can type your question in at any time throughout the presentation, and we'll come to answer those with the panel in the second half. Do know, though, that we can't offer any personal medical advice to any questions. So following on from part 1 of Flippin Arthritis, we're delighted to be welcoming back Associate Professor Tasha Stanton from the University of South Australia to present for us again today. She works at the forefront of arthritis research, so get your questions ready for her for that second half. If you'd like to rewatch the first webinar, you can do that on our YouTube channel, and the third one will be pre-recorded and will be sent to you out at a later date. So keep an eye on your inbox for that one. That will form all the questions we didn't get to for the first 2 webinars. So the presentation by Tasha will be followed by a question and answer session where we'll be joined by Celia, Ian and Peter, who all live with arthritis themselves, as well as consultant clinical psychologist Dr. Zoe Malpas and advanced physiotherapist Doreen Young, who will be here to answer your questions as well. And so with all of that, I am, as ever, delighted to introduce Associate Professor Tasha Stanton. Over to you, Tasha.
Thank you so much, Flick. It's wonderful to be here tonight, and I do have to apologize a little bit because if you hear some sniffling, that's definitely me. I'm a little bit under the weather, but I'm still very keen to be here and to share some of these findings with you. So I'm hoping that most of you had a chance to see the first presentation, but if not, no stresses, no worries. I'm going to recap some of the things so that you'll be able to follow along. So today, as Flick mentioned, what I really want to focus on is this idea of, is movement really for me? I know the evidence suggests that maybe I should do it, but is it really for me? And before I begin, I just quickly want to go through some different disclosures. And that's the fact that I do receive payment for lectures on pain and rehabilitation. I have written a book on osteoarthritis that talks about some of the concepts that we'll be going over today. And I have also received different research funding from different organizations. And of course, all of these things can influence the things that we think and we say, so it's important that we outline them at the start. So to start us off, in my last talk, what I did was give you a bit of a sense of what we sort of thought as a medical community about osteoarthritis and how many of those things that we thought were absolute truths and absolute facts actually didn't maybe seem to be the case, but that there was a very strong story that kind of went across both society and definitely was understood and taken up by people who had osteoarthritis. And you may, when I go over this slide, also feel the same when you hear these sorts of things. But this is work that was asking people with osteoarthritis, you know, what do you think about your osteoarthritis? Why do you think you have pain? And it came across quite clearly within this group that they believed that the osteoarthritis was due to overuse of that joint. So there were wear and tear processes, meaning that they were kind of doing too much and the joint just didn't hold up. And that the reason that they had pain was that their joint was really bone on bone. There was no cartilage left. And so, quite unsurprisingly, having this vulnerable joint, there were also strong beliefs that this would deteriorate over time. It would kind of only get worse. And so, unsurprisingly, then it probably didn't seem like a very great idea to be doing a lot of activity, because if I've got this joint that's overused, it's, kind of wearing out, and it's only going to get worse over time. I need to be really careful about how much activity I do, because it could only make it worse. Yes, I know that all these guidelines say that activity is good for everyone, but not for me. Because for me, I don't have any cartilage left, and so really, surgery is the only option. And this is a very widespread understanding of osteoarthritis, but the challenge is that the new science doesn't necessarily support this view. So I'd like to go over what we term, I guess, the old view, and then what the new, perhaps more modern view is based on the newest science. So the old view was really that osteoarthritis is a knee cartilage problem. So it's a problem with that tough connective tissue that lines the joints. And it's a mechanical wear and tear problem involving bone on bone. It's caused by age, injury, overuse, and its future is determined. There's not much you can do. It's really only going to get worse, and you'll eventually need surgery. But the new view is a bit different from this, in that it's not just a cartilage problem. It's actually a whole body process. And it's not just about wear and tear or bone on bone. It's this mild whole body or systemic inflammatory process, which can show up in any joint, the knee being one of them. And this idea that osteoarthritis is caused, by age, injury, overuse, well, some of these things can also contribute, but there are also many other factors that can contribute to osteoarthritis, including things going on in your joint, things going on in your gut, and things going on in your thoughts and what you believe. And importantly, the future of osteoarthritis is not determined. It can be constructed, in that there are many things that you can do to help it. It actually can improve, and it may not need surgery. So you can see that this old view and this new view are quite different. And one of the key aspects from my point of view is really this idea that when we think about, what is meant to happen, in the old view, it was all about inevitability. Like, this is just going to happen no matter what you do. And actually, you can make it happen even quicker and make it worse. Whereas what the new view, I think, gives us is hope. Because it's really talking about this aspect or this concept of bioplasticity. And this is the idea that all of our systems, tissues, as well as our, the body systems themselves, they can adapt and change. They are bioplastic. And this sticks around right until the very end, right until our very last breath. We know that as we get older, sometimes these processes can take a bit longer to change, but they still can change. All they need is a nudge or a push, something that makes them have to adapt. And so one of the best nudges and pushes of our body tissues and systems is really exercise and activity. So by changing the requirements that your body has to meet, it actually induces bioplasticity. It gives our system a challenge so that it has to dynamically adapt and change. And so in addition to some of these, very specific changes, we also know that exercise and activity has general benefits for us. So it can help with self-efficacy and confidence, so we can feel more confident in our ability to do things. It can also help with improving our general mood and quality of life. One of the key things it actually can help with, I introduced this idea before, that osteoarthritis is actually about low-level inflammation, which can make our pain systems more sensitive. And that in and of itself can make us feel, not so great. It's not always a nice feeling when you have higher levels of inflammation. But what we're starting to understand is that exercise and activity can actually reduce inflammation in people with osteoarthritis. And it does so by creating what we call anti-inflammatory cytokines. These little molecules, these proteins that talk with our immune system, and they actually help control inflammation in your body. So I want to go a bit deeper into this and give you some examples of how exercise has been shown to help with inflammation. So this is a study, And they were giving people, there were two groups that we're looking at here, a group that got exercise, and they also got a dietary intervention that was aiming to eat a bit more healthy and help them potentially lose weight. But the main goal of this was to eat more healthy. And it was compared to a group that got education on osteoarthritis and healthy living in general. And what they did is they compared these two groups, and they found that the group that had their exercise and diet, they had better results. They had greater reductions in their pain, and they had greater improvements in their function. But here's where it gets really cool. The group that had exercise and diet, they actually had reduced levels of these inflammatory cytokines in their blood. So, and then this study was so cool because they wanted to look a little bit further and ask the question, okay, well, this happened. They have this change in inflammatory level in their blood. Does it matter? And the answer is yes. They found that that change in or reduce in cytokines in the blood, that was responsible for 15% of their reduction in pain and 29% of their improvement in function. And this occurred without people having weight loss. So independent of weight loss, exercise can help change the inflammatory balance within your body and can have effects on symptoms. And I was, really curious, like, well, how could this be? Like, I kind of always thought that much of what we got from, reducing inflammation was through weight loss, because that's really helpful in reducing inflammation. But when we look a bit further, what we see is actually, and this is amazing to me, did you know that muscle contractions, contracting and using your muscles can actually result in release of this cytokine called IL-6? And IL-6, in certain circumstances, can help reduce inflammation. Isn't that incredible? But it gets better, friends. Hold on to your horses. This is a study that shows that not only can there be changes in this systemic or body-wide inflammation, so the levels in your blood, but these exercises, and this was strengthening exercises in particular, they can decrease inflammation in the joint itself. So these were people, this was a study that was looking at resistance exercise, so having to straighten your knee against resistance versus no exercise in women who had knee osteoarthritis. And what they did is this crazy measurement thing. I must say, I don't think I'd sign up for this study, but they measured all the fluids in the joint as well as just surrounding the joint. And then they checked to see what happened to inflammation levels. And what they found was this. They found a significant increase in this cytokine called IL-10. And this is an anti-inflammatory one as well, so it helps reduce inflammation. And that only occurred in the group that performed exercise. Now, what's important to know is that this cytokine, this IL-10, it's protective of cartilage. So what it does is it stops important parts of the progression of osteoarthritis by telling immune cells that are called macrophages to basically settle down so they don't release things that make more inflammation. So here we have evidence that exercise can not only reduce inflammation levels in our blood, but also in the joints themselves. And we know from the past lecture that this can slow down the progression of osteoarthritis by reducing inflammation, and it can reduce pain. So, exercise can do all this. What else can it do? Well, we know that it can make the pain system less sensitive in people with osteoarthritis. And I will come back to this a little bit more, a little bit later on in my talk. But it can also actually improve cartilage health in people with osteoarthritis. And here I want to take a bit more of a deep dive into this as well. So this is a study where what they were doing is they took people who had undergone a surgery to the meniscus of their knee. And so that's a picture there of the meniscus. It's basically a tough cushion of tissue, or of fibrocartilage to be specific. And it basically has a nice cushioning ability and it holds everything in place. So these were people that had surgery of some of that, the meniscus tissue. And oftentimes when people have this surgery, they are at a higher risk of developing osteoarthritis. They might not have pain, but if you looked at their scans, it will show osteoarthritic changes. Now, after they had this surgery, they were randomized to two groups. One of two groups, either an exercise group who got exercise 3 times a week over 4 months, or a group that had no exercise intervention. And then what they did is they did this very special way to measure the health of the cartilage. So to do this, they do an MRI of the knee. They measure for this GAG. That's a very hard word that I'll leave there in the parentheses for you. But this is a marker of the health of the cartilage. And what they found was really interesting is that cartilage health, it improved only in the exercise group. The dark little circles there, that's the exercise group. They were the only group in which this marker of cartilage health increased. And what was really cool is that the more physical activity they did, the more improvement in that health of the cartilage marker. So it suggests that in people who either have or are at risk of developing osteoarthritis, actually exercise and activity can improve cartilage health when we get it in the right dose. So we also see that exercise, it can be good at helping to reduce levels of body fat. And body fat can produce a very specific cytokine. Again, this is the talk of cytokines, but it's called adipokines. And adipokines can increase inflammation. So if you have reductions in body fat, you again can have lower levels of inflammation. And importantly, slowly but surely increasing exercise over time can help decrease the overprotectiveness or the oversensitivity of the pain system, even in people who do have what we call severe OA. So if we looked at a scan, it would be a higher progression of osteoarthritis. And again, I'm going to come back to that in a little bit. But I do want to really look at this and address this question head on. Should people with osteoarthritis exercise? Here are all the different people, very reputed groups that say yes. Osteoarthritis Research Society International, the NICE, which is the National Institute for Health and Care Excellence, RACGP, which is the Royal Australian College of GPs, College of Sports and Exercise Physicians. Our government says this. American College of Rheumatology, also Versus Australia, which is a UK-based group. All of these very reputable organizations agree. And I've just got to say, getting people to agree is not easy. So that's when you know that the evidence is strong and it's there. So I want to explore this evidence even a little bit further and say, is activity and exercise actually good for me? If, let's say, I'm someone and I've had osteoarthritis for a while, and the last scans that I got, my doctor said, or my health practitioner said, oh, those don't look so good. Well, here is evidence. This is from a systematic review, so taking lots of different studies together, but it was looking at people who had what were called end-stage osteoarthritis. So surprisingly, this actually doesn't tell us very much about how much pain they might have had, but if they looked at the scan, they would be at a higher progression of osteoarthritis. And these were specifically people who were awaiting surgery. And this is bringing together evidence from 4 different studies. I don't want you to worry about any of the details about this except for this one part. This little diamond there, that's showing you that when we put together all the evidence from all these different studies, it shows that people with they're awaiting surgery for osteoarthritis, if they start an exercise program, they have a reduction in their pain. It's beneficial for them. And so this is quite important, that undertaking exercise before surgery actually significantly reduces pain, knee pain in this case, even before the surgery occurs. So that suggests that, even when osteoarthritis it can be severe, there can be positive benefits of doing exercise if we get the load and the amount right. I think another question that is really important and that comes up a lot is this idea of, okay, well, maybe I should do exercise and it says overall it's okay, but is it safe for me to do? And this is a systematic review, again, bringing in lots of different studies, information from lots of different studies. And it found, when it considered all the information as a whole, that in people with knee pain who are undertaking low impact exercise, so this is things like walking, like cycling, possibly, doing some not having to squat down very far gardening work, but they found that there was no evidence of overall increases in pain. There was no evidence that physical function decreased. There was no evidence that when they undertook this low impact exercise that there was any progression of the osteoarthritis, so any worsening of the changes that they see in the joint. And there was also no evidence, as if you undertook low impact exercise, that there were a larger number of people undergoing a total knee replacement or some other type of surgery. So this suggests that if we get things right, we're not seeing any indicators that would suggest it is unsafe for people to do. So the answer, is it safe for me to do? The answer is yes. Now, I also want to share one study that this is getting out there, but this is looking at running in people with knee osteoarthritis. So these were people that had been runners their whole life. So please, if you're listening, feel no pressure that I'm telling you that you need to go out and run tomorrow. But what I'm saying is, even if we look at something that is an exercise that is not as much low impact and rather more high impact, like running, the evidence suggests that it's not increasing osteoarthritis progression or increasing symptoms. So this study looked at 1,200 people who had knee osteoarthritis, and they had them run at a self-selected pace. So however fast, however long they typically ran for. And they found that when people did this, it was associated with actually improved knee pain, no worsening in KL grade. This just refers to the way that they grade changes on a scan. So there was no worsening in their osteoarthritis, and no increase in new knee pain. So knee pain that might have just developed because of running. So this is kind of a key thing. It suggests that when we tailor exercise to where you're at, and this, you might be at a running level, you might be at a walking level, adding exercise in slowly but surely doesn't seem to worsen any osteoarthritis progression, and it actually has beneficial effects on pain when we get it right. Now, as I mentioned, this is not expecting you to go out and start running, because it's really important to understand that every little bit helps. You do not need to go out and run a marathon for something to actually have a positive impact on you and your osteoarthritis. Every little bit matters. So this is some studies that were showing that actually, even if you got 45 minutes total over a whole week of moderate to vigorous activity, that can improve function in people with osteoarthritis. And so an example of a moderate activity would be brisk walking that leaves you a little bit out of breath. And 45 minutes over a whole week, that seems doable. Another study saw, you may have heard this idea that you have to walk 10,000 steps per day, and that might seem like a huge amount. But this study found that, even increasing steps by around 1,000 per day, that can be really important in keeping you healthy. So it can reduce any risk of having a reduction or a decline in function. And one last thing, this was showing that if you think about your day, and you think about how much time you spend not, sitting, so doing sedentary activities, or doing some light activity, moving around your house. This study found that replacing just 60 minutes per day of that sedentary time with 60 minutes of light activity, again, that keeps you healthy. That reduces the risk of any decline in function. And so these light activities, that can be a casual stroll. So you're not out of breath, you're just going for a casual walk. It could be watering the lawn, Or it could be activities like when you go grocery shopping with a cart. So it's just really hitting home that everything adds up. All of the things that you're doing throughout your day, they count and they matter. So I've given you a bunch of different information that's really tried to hit home that many of the things that we might think of about exercise, like it's going to make me worse, it's going to increase my pain. Well, it's not always the case if we get things right, because we see that there's actually improvements in pain, in function, as well as nothing worsening in terms of osteoarthritis progression. But I think a key question that this comes to is like, okay, well, that's all great and good, but like, where do I actually start? And I would really suggest that the very first and the most important place for you to start is to really think about what is meaningful to you. So, what activities do you enjoy doing? Is it going for a walk in nature? Is it swimming? Is it cycling? Is it actually going to the gym or, attending exercise classes with a friend? But really think about those activities that are meaningful, because I mean, if you don't enjoy, going to the gym, having that as your activity that you choose to do, that is going to be really hard and very difficult to motivate yourself. So right from the very get-go, think of something and choose something that you really enjoy. And if you're having trouble with that, you could also maybe think of things you might miss doing that you might no longer do right now. Think back in your life of other aspects that you've done. You think, oh, wow, I stopped doing that. I really miss that. Is there something like that that might stick out to you? Or do you have a goal or a dream that might have been placed in that too hard or too late box? Is it something that we might be able to look at again? Or you might think of parts of your life that are more difficult than you'd like them to be. So things that you're like, oh, that feels like such an effort to do this. Well, what if you could reduce the effort that it required for that activity? That might be a good one to think about in terms of something that you engage in and get better at over time. Or if there's something that might be stopping you from reaching out to friends or engaging socially, is it the fact that maybe your social group always tends to go to a certain place, but it requires a bit of a walk, and actually that walk is limiting and it makes it difficult for you to attend? Have a think of those things, because they can be really, really helpful for this next part, which is really setting a goal and setting this goal for your activity of choice. Because the hard part is that often if we don't have a goal in place, it can be really easy to become demotivated or to feel like, oh, I'm not making any progress. But if we have something that's set in place, that can give us something to work towards. And actually working towards something can feel very gratifying. And so many of the clinicians that you may have interacted with will all have been taught, if you write a goal, you've got to make it SMART. And so I'll bring that same things to you. And by SMART, we mean it's got to be specific. When we read and when we make a goal, it has to be specific to an activity that we want to do in this case, and it has to be measurable. So we have to have some way to be able to judge if we have actually met that goal. It has to be achievable. So it becomes very demotivating if, for example, if I choose something really too hard, too quick. And it has to be relevant to you. And time bound. So we say, by a certain time, I want to achieve this. So some of the goals, I'll give you a few examples. It might be something like this. It might be like, in 3 months' time, I want to be able to walk for 2 kilometers on my favorite nature path. So we've got a time period, we've got something very specific, it's on my favorite nature path, it's measurable, I want to walk for 2 kilometers, and maybe based on where we're starting, it's achievable and it's relevant to you. Another example might be, in 1 month, I want to be able to cycle around my local park without needing to stop for a break. Again, time, being specific about what it is, and it potentially, I'm going to presume, because I've made it up, it is achievable. But this can be hard. setting goals can be really tough. And so you might need some assistance doing this. So there are people that might be able to help. So for example, health professionals like a physiotherapist, a GP, exercise physiologist, or you might be able to engage in some community ventures. So Flipping Pain has different resources on their website, as well as Live Well with Pain, both UK-based organizations. But there's also things, very tangible steps, I think, that are relevant to talk about that you can take in how you figure out how much activity is safe for you. Where is the place that you need to start? And it actually comes back to finding what we call your sweet zone. I introduced this idea in the last talk, but the sweet zone is all about the amount of activity that's right for you. It's not too much, it's not too little, it's just right. And so we can use how we feel during exercise to figure out if we're in the sweet zone. So for example, some of the things that can tell us that we might be in the too much zone is if we experience increases in knee pain or swelling or any joint pain or swelling that don't go away by the next day. We were probably in the too much zone, we did too much. Or if we feel a lot of fatigue or a feeling of muscle weakness, either during let's say a walk or the next day, you know, where it feels like your limb wants to give out. We might have been in the too much zone. But some tips and tricks that tell us that we might be in the too little zone might be if we do something, but we don't feel any muscle soreness whatsoever. And so this isn't pain, but this is just, you know, that feeling that you're like, oh, I've done something new. Oh, I definitely feel that. I'm a little bit sore. Another thing that might tell us that we've not been in, or we're in the too little zone, might be if you didn't really feel like your effort or your breathing rate increased very much more above that you experience when you're resting. So if you didn't feel like you were having to give too much effort, you might have been in that too little zone. But ideally, what we want to try to do is for each person, for you, we want to figure out what your sweet zone is. And I want to give an example of this through a walking plan. And the reason that I choose walking is partially because, I mean, it's so functional. Walking gets us everywhere. And if we're better and we can walk more, it also expands the different social options that we have. But I want to go through a walking plan and set it up for a person called Todd. So Todd has osteoarthritis in his knee and his hip, and his goal is he really wants to be able to walk down to the playground with his grandkids and actually be able to play with them when he's there. If you've been listening very carefully to my goals, you will notice that we've missed out on a time period, haven't we? So ideally, his goal would also be time bound. So it would be something like within 1 month, within 2 months. But let's go through with Todd on reaching this goal and how we might go about this. So the first key aspect is you need to find your start point. And this is all about discovery. So a great way to find your start point is to take 2 to 3 walks over a week. And if you can, choose a relatively flat walk. But think about, you know, how long you typically walk for before maybe your knee joint or your joints become uncomfortable. And you can use that a bit as your guide. But basically, you want to walk until you experience symptoms, things like pain, swelling, or stiffness, that are not likely to settle within about 24 hours. And this can be based on your past experience. You might not always know this perfectly when you're walking, but give it your best shot. Or you might walk until you experience, you know, a bigger than normal increase in your symptoms while you're walking. So you're like, oh, that was a bit much. Okay, I think I'm going to stop there. Or you might walk until you feel tired or notice you're actually less able to control the movement of your legs. So you feel a bit wobbly. So suggesting that the muscles are tired. So by doing this, you do these walks, walk until you experience these different things, and then you record how far or how long you were able to walk. So you can write down either, you know, the distance you went or the time that you walked for. And so basically what we're trying to do here is, because we're trying to walk until kind of symptoms just start to come on, we're trying to find the upper edge of your sweet zone. We're trying to find the point where we're just starting to push into the too much zone, and we know we might have done too much. So for Todd, week 1 was figuring out where to start. So he decided he wanted to actually walk with his partner because he thought it'd be more likely I'll actually do this if I walk with my wife. And so he decided to do that, and he went for 3 walks. First walk he went was 15 minutes. And actually he didn't really have any increases in symptoms, but that was how much he normally walked, and he kind of just wanted to start there. So walk 1, 15 minutes. Walk 2, he actually went a bit further. He went for 22 minutes. And this time he noticed his knee got quite sore, and it was still, decently sore the next day. So he knew that he kind of had pushed into the too much zone. Walk 3, he ended up going for 17 minutes. And at about 17 minutes, that was when he was getting a bit of soreness in the knee, and he was feeling a bit tired. So if we think about trying to find the right area to start, based on his experiences, we're probably pretty good choosing that one in the middle where, he was just starting to get a bit sore, but it didn't last. It didn't wait around until the next day, unlike when he did walk 2, which went for 22 minutes. So 17 minutes is a good place for Todd to start. So let's say week 2, Todd's going for 3 walks, aiming for 17 minutes for each of the walks. And so in terms of what he's doing, his start walking level is actually a little bit below that total capacity. I mean, he did walk for 22 minutes, but we knew that we were pushing in to the too much zone when he went for 22 minutes. So 17 is a great place to start. Now, some hot tips when you're doing this yourself. It's a really good idea if you can spread the walks out throughout the week so that you're not doing 3 walks on Monday, Tuesday, Wednesday, because actually you also have a sweet zone for rest. So you need to make sure you get enough rest and time off as well from some of these walks. And you'll notice over time, as you progress, you'll need less rest. But when you start out, this is a good tip. It's also relevant to think about your other tasks during that week. So you might have a really busy day of shopping on Wednesday. So maybe adding a walk Wednesday morning might not be the best thing to pair up with a lot of other activities later on. So maybe you do that on Tuesday or Thursday. And also plan it out. Put it on your calendar, because otherwise it could be so easily missed and forgotten. And then when you do it, check that walk off. Celebrate that achievement of saying, yep, I did that today, because that's something to really be proud of. We're keeping accountable. So Todd has done well for week 2. Let's see what we would do for week 3. Well, go for 3 walks, but aim to go just a little bit further. So this time it's about 19 to 20 minutes for each walk. And our rule of thumb is we try to just progress by about 10%. And so we're adding a couple of minutes to each of the walks. Some hot tips: stick to the plan if you can. So even if you feel really good, let's say one day you're like, oh, I'm feeling smashing, I've gone for 20 minutes, no knee pain at all, I'm just going to keep going. Try not to. Don't go too much further, because just remember, you're allowing your tissues and your systems to adapt to that increasing load. And this adaptation, this bioplasticity, it needs time. But also, if you feel a bit meh or a bit more sore than usual, still try to stick to the planned time as best you can. But if you are getting these large increases in pain or swelling or stiffness, it's okay to do less on some days. Don't beat yourself up. We all have differences in our days, and I'm going to go through an example of this in a moment. But so Todd, he went well for week 3, and now he's going to start week 4. You might have guessed it. He's going to go for 3 walks again, but he's just going to try to go a little bit further than before. So now he's going to go for about 22 to 23 minutes for each walk. So I want to give you some hot tips for this. Oh, the hot tips just don't end, my friends. But you'll notice with all of these things, he kept the number of walks the same, and he was only increasing the amount of time, or perhaps the distance that he was walking for. Whenever we're doing these things, we only want to change one thing at a time, because this allows us, our body tissues and our systems to adapt. So in our examples, Todd was increasing his walking time or perhaps distance. But you might also want to add an extra walk per week. So maybe you keep your time the same, and the next week you now walk 4 times. But making sure that you're keeping the other factors the same. You might also find that, well, actually, I'm going to need to walk with my grandkids and they walk fast. So my actually point is I want to increase how fast I'm walking. So I'm going to walk a greater distance. I'm going to go for a lesser amount of time, but I'm going to go a greater distance because I'm going to walk faster. And also you might find it useful that you want to change the walking surface or the layout of the walk that you're going on. So perhaps you want to go changing from walking on a footpath to walking on sand, or going from flat to walking on hills. And this is a really good thing if it fits your goal that you want to do. But I would just recommend that if you have a big change in your walking surface, like you're moving from a footpath to sand, you probably need to retest your starting level by doing that discovery phase of 2 to 3 walks, because we can't always assume, for example, that you can walk 20 minutes on a concrete footpath and also 20 minutes on the sand, because actually the sand is a lot harder to walk on often if you're not used to it. So a good goal to work towards if we're thinking about a walking program, and these are recommendations from the World Health Organization, is 150 minutes of moderate to vigorous exercise per week. So this amounts to about 20 minutes per day, or if we break it down even further, 2 by 10-minute walks, maybe one in the morning, one in the afternoon or evening. But remember what I told you before is even something like 45 minutes of brisk walking over an entire week matters. But this can be a nice goal, because this is a goal that's been shown to have other benefits to other aspects of your health. They also recommend strength training twice a week, particularly with lower body strength exercises like doing squats. And this doesn't have to be a full squat. This can be up and down from a chair. But this is something really relevant to look at and can be really helped out in terms of working with a health professional on this aspect. So a couple other things to think about is it's a good thing to have, if you're doing a walking program, to have a think about the shoes that you wear. You want them to be comfortable. You want them to be a bit supportive. They do not need to be the highest end trainer whatsoever, but just something that feels comfortable for you. And you might want to ask, do you want someone or a group that you can do this with? For example, in the UK, they've got the Ramblers Wellbeing Walks that is located in different locations in the UK, and they go for different walks that you can sign up for. You might want to find a peer mentor. This could be someone that's done this before, that's done some walking and done really well. And again, would you benefit from someone helping you out with this? And this could be a physiotherapist, a GP, an exercise physiologist, all these people that could help you navigate this. Now, I gave a very straightforward story, as in nothing went wrong for Todd in his walks. But I want to talk through a little bit more about what can happen when actually things don't quite go to plan. So what if Todd actually, in that week 4, when he's supposed to be walking for 22 to 23 minutes, what if he had a really big increase in his pain when he went for 23 minutes and it did not go away, for 1 or maybe even 2 days? What does he do? Well, first of all, a simple step that can be taken is to pop back down to the number, the duration of walk that he was going before. So he doesn't have to push through and stay at that high level, that 22 to 23 minutes. We can just acknowledge we pushed into the too much zone. But also it's quite important that it's not a panic, because we just have a check-in, and it's important to think about what sort of things might have contributed to experiencing more pain this week. Now, remember what we discussed last week, for those of you that attended? I introduced this idea that our systems, they consider all the available information of danger and all the available information of safety. And it's this balance of credible information of danger and safety that helps us determine how much pain we feel. And we call this DIMS and SIMS, or danger in me's and safety in me's. And if you remember, I gave you some examples of different types of danger or safety things that all make up our unique balance of protection. And so this could be, a danger could be things that you looking at your knee x-ray, versus actually a safety would be feeling strength in my leg muscles. A danger could be walking or knee exercises if we're feeling very worried that actually they might be doing damage. but they also can be a safety if we're like, no, I know that exercise reduces inflammation, and reducing inflammation is a really important part about reducing my pain. It might be the things we hear, wear and tear versus wear and repair. It could be what we think, surgery is inevitable versus there's many ways to improve my OA. Where places we are, it can be people we're with, it can be our mood, whether we're depressed and anxious or happy and optimistic, but all of these things, they matter. So if we look at Todd's situation and he reflects on some of the things that are happening that might have contributed to this experience of actually feeling more pain that didn't go away, well, he realized, when I did that 23 minutes, I actually did walk up a hill that was a bit bigger than usual because it was an extra bit of my walk that I'd never been. All right, so that's a little bit of extra load right away. But also, he remembered his car broke down this week, and actually he felt really worried about getting it fixed. And because he was really worried, he really slept poorly the night before he went for this walk that flared his pain. And actually having his pain increase made him think, oh crap, is this really safe for my knee? And it comes back to what goes on in terms of our sweet zone. If we have more things that give us information about danger, that upper edge of the sweet zone can shift. It can go from here to here. So it takes less activity for us to get into the too much zone. And so these reasons, these additional things going on in life can also shift then how much our system is protecting us. So if we go back to the other diagram that I did talk about yesterday, for those youth that may not see this or may not have seen this, it's just about how big the safety buffer is often due to various changes that occur in the pain system in people with osteoarthritis. Here, what we could be saying for Todd is that lots of other things that are occurring could have been contributing to a greater safety buffer, meaning that he's feeling pain with potentially less activity. So the good news about all of this, though, is that we can maximize our sweet zone. So for example, if we reduce DIMS, danger in me's, and we add or enhance SIMS, we can help maximize our sweet zone. So maybe to reduce fear and worry, a really good thing would be that Todd decided to talk to his physio about the increase in his knee pain. And he felt reassured by that. And he also, to make sure that he understood it and that he believed it deep down in his gut, he explained this to his partner, some of the different ways that exercise can help an his joints. He still has this DIM that his car's not fixed and it's worrying. So maybe he can't really change that DIM. So he needs to add an extra SIM. He needs to add, maybe go and ensure he's not walking in loud, noisy places, but he's walking in nature. But so all of these things, the nice bit, these are under your control, and they're ways that you can explore your unique situation to maximize your sweet zone when you're undertaking activity. Now, for the very last part of my talk, and before we start with our panel session, I want to share with you a real world case study and someone who's going to be joining us on the panel a little bit later. But that's a case study of Mr. Peter Neens. Now, Peter has very kindly agreed to share some of his story with us today, and so I hope you enjoy it. So Peter, when we first met, he was 65 years of age, and he had been diagnosed with osteoarthritis in both of his knees. And Peter works as a consultant for research for development in agriculture, and still is currently working in that role. But in his life, he also played Australian football for quite a few years, and through that had various different injuries that occurred, including he underwent arthroscopies both in 1990 and 2006. So when they look into the knee and kind of they so-called clean it up, and he also had a previous ACL tear to one of the ligaments in his knee where luckily, they put it in plaster, and actually it ended up healing on its own, so he didn't need surgery. But so he had some things that had been done in his knees before. So he had gone to a clinic, a sports med clinic here in Australia, and he had some x-rays done. So he had them quite a while ago, but then he had them redone in 2016. And he was basically kind of told the message, oh, this doesn't look good. You likely need surgery. Now, Other things relevant to know about Peter is that he has a research and a science background. So he was really interested and somewhat vested in the role of science in our everyday life. And so he, in that way, was also a bit ready to challenge this kind of presumptive attitude that surgery is the silver bullet, the one thing that will help. And he also had a good friend who had, quite significant problems after he had his knee replaced, and these challenges continued. So he wasn't too keen to jump in to get surgery. And so Peter actually signed up to be part of one of our trials. And so he was one of our pilot participants. So he received a 12-week intensive pain science education intervention that was many of the things that I discussed with you in the first presentation and touched on a little bit today. But he also received a walking program, and together this was provided by a physiotherapist. The walking program itself actually extended over a 1-year period. And he worked with a physiotherapist to identify an activity goal that was meaningful to him. Now, what Peter identified was he actually chose walking the Camino Trail in Spain as his activity goal. Quite a lofty goal, you might agree with me there. But let me tell you how things went. So within the walking program, Peter, it wasn't without challenges. So in week 4, he developed some hip soreness. Week 10, he had some hip, knee, shin soreness and some swelling, and he had to reduce his activity levels. Week 15 and 16, he had some general soreness. Overall, it wasn't too much modification to his walking program, apart from a couple of reduced activity days in week 10. But what this allowed him to do, though, was to really look at what were the sort of things that were occurring at the same time as these kind of increases in soreness or pain. And so in week 4, Peter attributed this soreness to actually having to walk on the pavement in Adelaide. So normally he actually does his walks on Middleton Beach, so in the sand or on a trail. Week 10, he actually did a lot of steps, so he attributed this to increased workload due to steps. But then week 15 and 16, he attributed, he was in Adelaide doing walks again. And he's like, oh, there's a lot of traffic and noise, and it's not very peaceful to be walking in Adelaide. And so some of this helped him to then unearth some of his unique DIMs and SIMs, or danger in me's and safety in me's. And he found for him a danger in me was really walking in the city. It wasn't peaceful. It was loud noises. You always had to watch to make sure someone wasn't turning, they're going to hit you. All of these different things that aren't the most conducive to an enjoyable walk. In terms of SIMs, he found that knowledge was a real sim for him. So understanding that he can shift that sweet zone, so he can do more activity and he can still be in the sweet zone because he's actually pushed that over time. Having a preparation for the long-term goal, this walking the Camino Trail was a sim, but also his support through his physio sessions. And so let me show you a little bit about Peter's journey. So these were some of the trial outcomes that we had. So we found, first of all, this is his pain intensity scores. So we started at baseline and over the year, and he went from about a 6 to a 1 on a 10-point scale, which is a really lovely reduction in pain. If we look at function, this is looking like it's getting worse, but this is a weird scale, and lower scores are actually better function. So this is showing a nice improvement in his function. And also we looked at his average daily step count. So we had him wear a watch that measured his movement, so measured step count. And we found a really nice improvement in step count. So he started at about 8,000 and he ended up at a little over 12,000 that he maintained over a 1-year period. And so this is, I think, a lovely illustration of the idea that if you slowly increase activity over time, it can reduce the overprotectiveness of the pain system. Because here we have Peter that's feeling less pain, but he's actually doing way more activity than he did at the start. And the good news is he walked the Camino Trail. So this is a picture of him when he had done this walk. So it was from Leon to Santiago. So a big walk, 320 kilometers over 14 days. Biggest day was about 32, shortest day was about 9. But there were hard bits. So there was parts where he had to go downhill. Luckily, some kind Samaritans lent him some hiking poles. But it was interesting because he reflected his DIMs, his danger in me's remained constant. when he walked through big cities, that was some of the hardest bits. It was not the highlight. And some of the really key triggers for change that Peter shared was this recognition that a conservative management approach is viable. So there's a possibility that doing things like exercise, education, and working to reduce inflammation can help. This idea that, you know what, I have family and friends and health professional support. This is key. And definitely understanding that osteoarthritis is not a downward spiral and that there are non-surgical management options, as well as thinking positively about health and well-being, including potentially losing weight. And for Peter, it was a modest 10K. But all of these things were important. Some additional triggers for change for Peter were really having an aspiration or goal to work towards, a physical and a mental challenge that requires preparation and some hard work. And your aspiration or goal does not have to be the Camino Trail. That's huge. I don't think my goal is that. But if you find one that means a lot to you, that can be the world of a difference. Peter also shared that, the trigger moment for me is when I showed Kim Wilson, who is his physio, my x-rays, and she just said, there's no reason you can't undertake the Camino. This flipped a switch for me, and therefore it became not if, but how and when. And remember from the last lecture that what we see on scans, the evidence suggests it does not dictate what we're capable of doing. Other things he shared was, having committed to the outcome, the preparations and arrangements to achieve that outcome actually became embracing and interesting. And from that moment on, my knees were no longer an impediment to my lifestyle, but rather the means by which I would achieve my goal. So his key 3 ingredients: knowledge, support, and setting that goal. And you may also find and remember that not only are what you're doing is influencing you and your life, but it can positively influence others. So this was a quote from one of Peter's friends, and you'll be pleased to know that I've been vigilant with the GLAD program, so an exercise program, and it's going well. I don't want to admit it, but you may have been right regarding exercise and perhaps no surgery. Maybe I will find a long trek to aim for in a year's time to test my knee. So to summarize today, I hope what you've come away with is solid knowledge that activity is safe and beneficial for osteoarthritis. And remember, every little bit helps. And the fact that we're bioplastic. Exercise and education are some of the best ways to introduce bioplasticity. Think about your activity goals, what's most meaningful to you. And if you find activities you enjoy and people to enjoy them with, you will be well on your way. So on that note, I'm going to turn us over to the panel, and I just thank you very much for your attention this morning.
Thank you very much, Tasha, especially given that you've been under the weather. That was brilliant. We've got all the hot tips that you gave us there. That's brilliant. Let us introduce our panel. So if you haven't already put your question in the box, please do that while we introduce our panel. I'll come first to Dory Young. Do you want to introduce yourself a little further there?
Hi there, I'm Dora Young and I'm an advanced musculoskeletal physiotherapy practitioner. I work for Manchester University NHS Foundation Trust, and I work in first contact clinics in the community with GPs and also at the specialist musculoskeletal and orthopaedic clinic.
Brilliant. Thank you very much, Dory. Dr. Zoe Malpas, would you like to go next?
Oh, brilliant, thank you. Well, thank you very much for the opportunity to talk to everybody today and to answer some questions. My name's Zoe and I'm a pain psychologist. I also work for Manchester Foundation Trust. I work for Manchester NHS Pain Service. I'm based at Wythenshawe Hospital at the front end of the week, and I'm at Manchester Royal Infirmary on Fridays. But thanks for the chance to talk to everybody.
Thank you very much, Zoe. And Celia, would you like to introduce yourself next?
Yes, hello, my name's Celia Borland, and I've been living with persistent pain and osteoarthritis for several years now. I'm retired, and the onset of my arthritis started very shortly after my retirement, which stopped me doing the thing that I really love best, going round walks around Hollywood Park where I live. And that became part of my goal. I found that I was very overprotective at my arthritis started during lockdown, so I was very protective of activity, and I shut myself down so much. And it was only when I spoke to my GP about how we could manage my medication, because I was taking a lot of medication at the time, that she had actually been on a webinar about arthritis and said, well, it's not, don't give up now, that there are things to do, and exercise is one of the things that you should be thinking about. And that got me in touch with a physiotherapist who, on my first visit, showed me the Flippin Pain website. Tasha had done a webinar on Flippin osteoarthritis, and that changed things for me completely. So I've been walking and having exercises and gradually built up, as we've been talking about today, and it has really transformed my life. So I'll try it now.
Oh, that's brilliant. Thanks very much, Celia. Thanks for joining us today. Ian, great to have you with us. Would you like to introduce yourself?
Hello, yes, thank you. I'm Ian Taverner. I live with osteoarthritis and FND. One of my great nudges came when I decided to write a cookbook called Cookfulness, which is for people living with chronic conditions and disabilities. And that's led now to a completely new career of me working with hospitals, charities and organisations up and down the country, helping with cooking workshops and programmes.
Awesome, thank you very much. And Peter, we've just been hearing about you. Would you like to put a face to a name here and introduce yourself again there?
Definitely, I'm Peter Nunes, and Tasha has done a great job of telling my story. I've been living with, at least living knowingly, with osteoarthritis for the last 7 years. And probably for a lot longer unknowingly. And I attributed my inability to continue to play competitive tennis and so on prior to 2016 to just general wear and tear associated with joints that took some tumbles when I played football, Australian football. So I really hadn't thought too much about it until I went to the sports medicine clinic in 2016, and the guy that I had been seeing for a number of years said, look, come back in 2 years and we'll replace part or all of your knee. Simultaneously, I had a friend who had a knee replacement, and he was having another knee replacement, and it just went bad. It's been 3 years now, and he's been in and out of hospital, infections and so on, and it really hasn't been a good story. So I kind of had two things happening at the same time. One, I read a very negative example, and the other, the possibility of actually doing something that wasn't surgery based or a silver bullet approach. And this came home to me, what kind of has been highlighted in the work that I do, which is in developing countries, primarily in Africa, which is about introducing new technologies. And what I've come to realise is that actually a new technology is only part of the story. And in order to introduce a new technology, there are a whole lot of other things that need to happen at the same time. And I think the analogy with conservative management of osteoarthritis is a good one. And I mean, Tasha's done a great job of telling my story, but I'm certainly look forward to answering questions when we get to that stage.
Marvellous. Thank you very much, Peter. And thank you very much, all of you, for joining us. We have some great questions to get through. I want to start with a great question that at the beginning. Will it be painful at first? So when I start to get moving, might it be painful? I think if I can come to Celia, Ian and Peter on that, and then let's get a professional opinion as well. Celia, I'll come to you first. Walking was your thing, isn't it? Was it painful to start with, and what would be your advice to somebody who's at that day one level?
It definitely was a challenge, and I started very small. And also used the exercises that I was given by my physio, which I was helping to strengthen my legs as well. My osteoarthritis was in my left hip, so that I was actually, instead of my usual walking would have been on grass and up a hill, but I started using pavements and found that helpful, so that I knew that I could get home within sort of easy range. So just started small and gradually built up, a bit like Tasha was suggesting, so that was the way I started. And walking in the city is sometimes hard because there's a lot of noises as well, ambulances passing, and that I found less helpful than when you're walking in the country, in the park, where there were birdsong and there were other lovely things to take your mind off it.
Absolutely. How small was small when you started, Celia? How small was your walks?
Well, it was starting off about going round the block, and then going round 2 blocks and 3 blocks. And partly that was also because it was winter time, so it was slippy, and that was how, I suppose, about the protectiveness of myself. I was so worried that I was going to fall and make things worse. So therefore, walking around the pavements was a good way of starting, and that there were ways to get home easily.
Brilliant, thank you very much. Ian, can I come to you on that as well? Where did you start on your journey towards physical activity?
Yeah, my goal was very much to walk with the dog. It's something that I've not been able to do, or not felt I was able to do, for a very long time. And I think my brain had trained itself that things were going to hurt before they even hurt. So understanding what the pain was, and was it actually happening, or was it pain that I was creating, almost sort of catastrophizing it before it had happened, was my first barrier to get over, I think, to say that actually this is going to help. And I mentioned that the cooking, you're thinking, what's that got to do with anything? But actually the psychological side of that is it makes me happier, and when I'm feeling happier, I feel more likely to want to be able to do the walking. So they sort of come hand in hand together, and I needed that sort of marrying together to help me get to push one along with the other. So starting very small walks, and I look back at that now, and having heard what Tasha said, I think had I known what I'm knowing now, then I think I would have been sort of doing things a little bit differently, but certainly going slowly and then gradually building it up was exactly how it worked for me. And my goal with the forest, I'm lucky to live near the New Forest, and being able to take a walk in the New Forest with my family and the dog was like a hallelujah moment. But that was never going to happen straight away. It had to come sort of slowly.
Spot on. Thank you very much for sharing that, Ian. Peter, I'll come to you with a similar question, and I want to add a layer to it. You were a sports person. Aussie Rules was your sport, and as Tasha had described, you'd had various injuries and arthroscopies, surgeries. Did you have to reconcile your relationship with physical activity? Was it something you'd stopped not only because of pain, but possibly because of fear of injury and doing more harm? Would that be something you'd be happy to talk about?
Yes, most definitely, and certainly I really cut back on physical activity. I gave up playing tennis, which I enjoy, because I was just having dreadful, swelling in my knees. I was having pain at night, so I was taking pain medication during the night, and I thought to myself, this is not sustainable. So when I joined the trial at the University of South Australia, I had a program to follow, and like Ian, I'm fortunate in that the local environment is conducive to walking. We live on the coast, just over an hour south of Adelaide, for those of you that might be familiar with the geography of this area. And basically I can walk on a nice flat beach all the way to the mouth of the Murray River, which I haven't done because it's a long way. But I started walking 5-6 kilometres a day, and I continued that. I started doing that 12 kilometres twice a day in preparation for the Camino. And any time that I did feel a little bit of pain, because of the knowledge that I had through the trial that I was participating in, I was able to cut back on a couple of days and the swelling went down and everything was good. I mean, in hindsight, walking on the beach at Middleton, this is Middleton in South Australia, wasn't perhaps ideal preparation for the Camino because northwest Spain is quite mountainous. But nevertheless, it's a lovely environment to walk. And I think having a nice environment to walk and having a reason to walk is really half the battle.
Brilliant. I'm sure many similarities between Middleton, South Australia and Middleton in the northwest. The beach probably not one of them, but no, brilliant. I will come to Dory as well as a physio, Dory. We've got a question from Fiona who's saying, like, some days I've got foot arthritis and some days it is literally hard to put one foot in front of the other due to pain. What would be your advice to somebody who's at that situation to get moving from there?
Yeah, and I think that's a really interesting question, isn't it? Thanks for that. And I think that graded, activity and starting really small, it was really interesting to hear from Tasha that even those small levels of activity can have a really positive impact. If you feel that you're not even able to start at that low level, for me, that would be the perfect time. I'd want someone to book in and come and have some early one-to-one physiotherapy advice. And in Manchester, that will look like you can normally self-refer into physio, or your GP can, or lots of the GP services now across central Manchester that have first contact physiotherapy clinics like the ones I work in. And that would be the perfect kind of question that I would welcome in my first contact clinic.
Brilliant, thank you very much. I'll stick with you, Dory. We have a question from someone who has never exercised before, is listening to this, maybe feeling a bit inspired, but wondering, does it need to be supervised? Do I need to get this support, especially when we know what waiting lists can be like at the minute? What would be your advice for someone who's brand new to activity?
So I would say to someone to give it a go themselves to start with, and that I would feel confident that the majority of people can start small and build up. If, however, they're very apprehensive or they're struggling to start that initial program, then there's lots of different ways they can reach out. So we talked a little bit about how to access physio in central Manchester, but we've also got some really other helpful services available as well. So we've got something called Manchester Active, and that's quite general, but that maps out all the different classes, gyms, groups across the whole of Manchester. If they wanted a bit more medically led or supervised exercise programs, they also have things like the physical activity referral scheme, and a GP or a physio can refer you into that fairly simply. And they do have a group actually where you attend twice a week and you have 20 minutes discussion followed by 40 minutes exercise. So certainly there's lots of ways that patients can get supervision, either with a physiotherapist or other healthcare professional, but I would encourage people to give it a go themselves first.
Spot on. Thank you very much. Zoe, I'll bring you in on this next question. We know, as we've just talked about there, when you've not done exercise before, it's a barrier to starting physical activity. Another barrier that somebody's mentioned is anxiety and depression, which we know is common when somebody's living with persistent pain. Would you be happy to talk about, from a pain psychologist perspective, how can we start to move past that barrier?
Absolutely. I've just typed quite a long response. I will still click send, I will do, but yeah, I guess the first thing I want to say is thanks for being brave enough to say that, because I think most people I've met who have been unlucky enough to be left managing long-term pain, a completely normal psychological reaction to that is to be feeling kind of scared of moving. Absolutely. We expect that to happen. Also, to be getting frustrated when you can't do the stuff that you've been planning to do. That frustration is entirely normal as well. And unfortunately, the longer it goes on, the more normal it is for people to start getting really down and even depressed. And all of those are a totally normal psychological reaction to living with persistent pain, but it does make a rotten situation 10 times worse. I think the specific comment in the question and answers is about during a flare-up as well. And I think often they're the most difficult parts of kind of living with chronic pain that to be able to plan for. So what I've started to type in my reaction is try and think of something that makes you feel like yourself, even on those worst days when you can't do the things that you want to do. So it might be texting a friend, it might be listening to your favourite music, it might actually be doing something like breathing or relaxation exercises to help you manage that normal bodily response, that stress response, that adrenaline to your pain. In fact, one of the things I'm hoping to do is we've recorded some videos on our Trust Pain Management website. So there are some things, there's lots of advice there about breathing exercises, relaxation, managing our kind of scary thoughts when we're kind of in that awful situation. So I'm going to pop that in the question and answers section as well. But my advice is do something that makes you feel like you. And even if it's only something simple, it's you starting to feel like you've got a little bit of control over the situation. And as your flare-up starts to ease, then you can gradually start doing more again. I guess I should say, though, that if you don't find that your mood starts to improve as your pain, your flare-up starts to settle, then there are always people that can help you. And often your GP is the first port of call to getting kind of more specialist help if it doesn't start to improve as you start doing more of those specialist, those things that make you feel like yourself, that you really value. I shall pop that into the chat function as well, so it's there as well. I'm also going to pop the link to those videos. But yeah, thanks for asking that. I think it's really brave to raise it, but I think that's a really normal psychological reaction, particularly to a flare-up. Thank you.
Brilliant. Thank you very much, Zoe, and for those resources that you'll put in the chat. Ian, I'll come to you. Would you be happy to share a little bit about your experience on that topic?
Yeah, absolutely. Depression and anxiety was something I really struggled very badly with for a number of years, and I still do. And it was actually the combination of anxiety and depression and pain that sort of forced me to stop my career that I had. And for a number of years, I didn't do any work and was almost felt like it was lost. And I found that the depression, anxiety, and the pain were sort of pulling on each other, spiraling them downwards. And it was only really when one started to pull the other upwards that things started to change. But I needed to but address both of them, not just one. And that's really where things like walking and the cooking came in, because the more I was able to stimulate myself, as Zoe was saying about feeling a little bit brighter about the world, the more I was feeling more able to actually start to do some exercise. And I found that particularly when I was flaring, when you're in those flares, that's the hardest part, but actually probably the most important one to try and actually do a little bit of something, because giving yourself that little boost also makes your sort of retrains the brain a bit, that the memories you sort of create of things not going well sometimes can force your actions to do something. Whereas actually, if you can start to do those little things, it just helps you to say, actually, I did it last time, I think I can probably do that again, and then gradually build it up. And just very briefly, I found that on the sort of the bad days, I would do not very much, and on the good days, I'd try and do too much. And then you'd end up sort of booming and busting on the good days, and then you'd have more bad days. So I think getting that balance right and trying to do a little bit more on those lower days really does help, and both your physical and your mental health. It certainly has for me.
Well, and thanks very much for sharing that, Ian. Peter, would you like to add anything about your experience within mental health and physical activity?
Sure. I mean, I can't really speak to depression, but certainly I would echo the comments that have been made about anxiety and just starting to do something that makes you feel good. And in my case, I wasn't overweight, but I was keen to lose a little bit of weight, so I enlisted my wife to help. She's a nutritionist, and just losing a little bit of weight, you start to feel better. And then that goes together with the fact that you're exercising, and it all, you start to build some momentum around all of those feel-good factors. And you know, I would really encourage people to just start somewhere, and having support, particularly at home, is really important. And just building on little achievements as you go along.
Spot on. Thanks very much, Peter. Tasha, I'll come to you with a few people have mentioned a few different things that they may use in addition to exercise, or may use to help them be able to access exercise. There's three that have come up in the chat today, and I wonder if I could put those to you, and then we'll ask some of the other panelists as well. So the first one being anti-inflammatories. Is there a role for those? The second one being probiotics, and the third one being CBD oil. What are your what's your knowledge and thoughts on the evidence for those things?
Sure. So there's certainly people can use anti-inflammatories. I think the challenge there is it's not like anything else that we take that are often medications that are trying to stop a certain process. They're not great for us in the long term, so they can be really tough on various other systems. So there's not the chance of having side effects due to those is much higher than something that there's like exercise, for example. But I think that particularly in the early phases and particularly when you're working with a healthcare professional, there can be places for things like that. So one of the more common ones is actually not a pill, but almost using a gel or a rub. Pardon me, I've got a running nose. But so some of those things can be useful adjuncts, but often we just don't want to be reliant upon them for a long period of time, because that can have some negative effects. In terms of probiotics, look, I think the gut microbiome stuff is just, the knowledge that we're having is growing at such a big pace. There's some evidence to suggest that that can be helpful. It was interesting because I was looking at some of the studies within this area, and the best evidence suggests that it's daily changes or daily things that you're doing that have the most impact in influencing the gut microbiome. So, for example, daily dietary choices of eating well, daily activity, all of those things are shown to have a greater ability to shift some of the various different microbiome constituents that are there, because that is the difficulty actually, is that when you have so many different things contributing, to actually shift over a long period of time takes concerted effort. The probiotics, I'm not probably aware of the most recent literature that was there. There was some a few years ago that was basically showing that ensuring that what you're having actually still has alive bugs within it is quite important, but that people were having benefits when they were using that over a period of time. In terms of CBD oil, I'm actually not, I'm not sure. I'm not up on the literature in that area, so I can definitely take a look and give some feedback after and share resources on the site, but I can't answer that at the moment.
No problems. Maybe something we can come back to in that third webinar that we'll record in a few weeks.
Yeah, great idea.
Fab. Ian, would you like to come in a bit on your experience of using things like medications to assist with your physical activity?
Yeah, absolutely. I think when I was sort of first feeling a lot of pain, I was on a lot of medication, and it was very much short-term medication for long-term conditions, which at the time I didn't really understand. But unfortunately, that led to sort of having to have more and more of it, because you sort of grow a tolerance and you need more of it. And I found that was actually making me less wanting to do anything, because it was sort of messing with my head and emotions a bit. And I think once I understood, the big question was, what's the implication of me not taking this? Once I was able to ask my clinician that question, it suddenly changed the whole dynamic of, well, actually, it'll probably make you feel a little bit easier in the head, but you might feel a little bit more pain, but actually that might allow you to do a bit more exercise. So it's finding the balance that's right for you, I think, in terms of how you feel. And on the issue of nutrition, I think nutrition generally obviously is really important in terms of how you generally feel. And I think if you're feeling what sort of better within your body, then you're more likely to want to be able to do more things as well. But I think the word nutrition scares an awful lot of people. You sort of think you have to go out to Mongolia to find the sort of strange grass that lives in the corner to get that, and it's not really that at all. I mean, it's just about eating a bit more healthy, a bit less sugar, and sort of understanding what a balance means. So I think that in itself can help as well in terms of how you feel and about how you want to achieve, and achieving your goals will come a bit easier because you'll feel better yourself. So I think medication, nutrition almost can work with each other to help you. One might come down as the other comes up, but I would say with medication, just make sure you're doing it with people who understand what that medication is and how coming off it or going on it can impact you, because they can cause you and obviously side effects and issues. So, and I'm not one of those professionals, so I'm just purely talking from my own perspective there.
No problem at all. Thanks very much, Ian. Celia, I'll come to you on that as well. So things that you've used as adjuncts to help you with physical activity.
Yes. One of the things that I found very helpful was that in our GP practice, we also have a pharmacist who came on, and she helped me, because I was wondering if I should be taking an anti-inflammatory, but very quickly found that it didn't suit me. But she suggested using a topical cream for a while, and that actually helped me to boost my capacity to go out walking. And also, I suppose, as I was listen, I used to go out with headphones on and sometimes listen to a Flipping Pain podcast, and that sometimes really helped me to increase my walking as well, and to learn more about pain and how I would manage it. And that also led me to explore different ways of developing my diet and improving my diet as I went along, and I have found things that have helped me. And as the others have said, I lost weight just by walking. It wasn't intentional, but my diet did improve, and I did lose some weight as well. All things that helped.
Brilliant. 2 for the price of 1 on the podcast there. As you say, a bit of distraction, a bit of enjoyment, and educational as well. That's awesome. Peter, I'll come to you just for this last part of the session with the same thing. Have you got any advice to anyone as to add to their physical activity?
No, simply to echo what has been said already. I mean, my own experience with pain, I think I did mention this earlier, that prior to entering into the trial, I was not sleeping well at night. I was waking up with pain in my knee, and I was taking some low-level medication, which I hate doing. But once the trial started, I stopped that, and in fact, I stopped waking up with pain during the night, which was excellent. But I know that there are a lot of natural supplements out there, and people take them, and if they have a placebo effect, well, that's fine. But I didn't do anything special medication-wise while I was entering into the main part of the trial.
Marvellous. Thank you very much. And thank you very much to all our panellists there. That comes to the end of our session today. Thanks for everyone who's joined us in the audience. As I say, thank you to our panellists, and thank you to Tasha as well. We will be recording a 3rd volume of this Flippin Arthritis series that we'll send to you via email. Me and Tasha will be pre-recording that. So you will see in the chat box just now a link to a feedback form. We'd love it if you could spend 5 minutes telling us what you think about today, things we can do for future events. Your feedback makes our future events better, so we'd love to hear from you. Please let us know. You can also get in touch with us in other ways, so you can access us on social media at Flippin Pain across the board. You can also email us info@flippinpain.co.uk, and you can head to our website as well. You can see the QR code as well, so if you've not got access to the link and you want an even easier way to access it, hover your smartphone over that QR code with the camera option available on your phone, and that'll take you to the survey as well. We'll leave that up for a second, and then we'll put our email and website details just here as well. Website that we've mentioned, Celia mentioned previous webinars and podcasts. You can find those all flippinpain.co.uk. Thank you very much for joining us, and have a great rest of the day. Thanks everyone. Bye bye.